Well, obviously the one that's on every newspaper, news story, everything, at least on a weekly basis, is the issues with cybersecurity. Cybersecurity is really one of the things that keeps our members up every night, because there's no amount of money, there's no amount of work that they can do to be 100% foolproof from a security perspective. What they're really doing now is trying to figure out from a risk model how they can really approach this in such a way that there's reasonable protections and ones that will at least make a difference on a daily basis. The other things they're really doing is really trying to figure out how to work in their communities, to empower the patients, to share data across continuums, to make sure things are working in such a way that they see these great outcomes as we shift to a risk-based payment system. These are all things being handled, plus probably 1,000 other things in an average daily CIO's life that they've got to focus on. Yeah, the things that are happening right now in our industry we're at such a interesting point of inflection in the change of whether it be the payment models or whether it be the stresses on the industry as a whole. So our members are really trying to up their skills, in particular areas such as cybersecurity, next generation of care such as population health, risk-based contracting, preparing their organizations from a leadership perspective, not just IT, to be ready to move in those models. We're also pushing really hard into areas where not only collaborating with the government, but as an industry as a whole, to really try to do things such as standard setting, best practice sharing, to really reduce the burden of this transformational process where we can really accelerate it to make the change that's needed for the industry. 1992 seems like not that long ago, but 25 years. And the role really of the original CIO was really kind of the data processing leader in an organization. It was about the initial states of bringing financial systems on. Now a CIO has responsibility for everything electronic, whether it be data or the hardware or the systems, across an entire enterprise. They're really responsible for bringing the entire organization to this next level of information sharing, to connect to communities. It's no longer about just running a certain small portion of the hospital. They're going to be the glue that holds everything together, and not just holds it together, accelerates it in such a way that we'll see the radical change we need to improve healthcare in the U.S. This year, CHIME launched the Patient ID Challenge in partnership with HeroX. And our goal was really simple, and that was we want to find a solution, not necessarily just an identifier, a solution for identification for this country to reach what we think is an absolute must for patients, families, for communities, and that is 100% accurate identification of patients 100% of the time. We've been now working through this. We have 370 plus people competing in our competition. We just exited the first round of this process called the Concept Blitz. We're absolutely enthusiastic of what we saw during that process, that we're going to find a solution to this relatively soon. We run into this in Q1, Q2 of next year, where our plans are, unless we continue to see the interest, it may take us a little bit longer, to actually have a solution in place to be able to look at future stages of rolling that out for a countrywide identification system.